Hello friends, welcome back to my channel. Today I will tell you regarding OET speaking role play. This role play is based on a pediatric ward setting. Means it is a bystander role play. In this, the background history is you are in a children ward in a hospital. A 5 years old boy has been admitted for a tonsillectomy. His mother is present. You are preparing the child and the mother before the surgery. So it is a bystander role play as mother is present, and as a nurse you are preparing the child and the mother both before the surgery. So first is the introduction part. In this, greeting plus self introduction. That means, as a nurse, we can say, "Good morning, my name is Raman Gill, one of the registered nurses working in this pediatric ward. If I am not wrong, you are John's mother," because we can ask or clear that she is John's mother, okay, or not. And along with this, we can also say, "I am here to prepare you and your child for surgery." So we also ask the mother name. So for that, we can construct the sentence like this. "Could you please tell me your name for our better conversation?" Because here a conversation is between mother and a nurse. Okay, so we can ask the name of the mother. So suppose here the mother name is Mira. Okay, so we can start our introduction like this. Next we can proceed to the task number 1. Here task number 1 is check how the child has been feeling since admission. So here the check means clarification. We can ask from the mother that how his child is since he was admitted to the ward. Okay, so we can construct the sentence like this. So before that, I would like you there to know how John has been feeling since admission. So, his mother said that John is good and like this. Okay, so we can say, "I'm glad to hear that." Okay, so next, as a nurse, we can ask in second task, we can ask the symptoms of the child like this. Task is ask if the child has been shown any symptoms recently like sore throat, fever, or difficulty in swallowing. Check if pre-operative instructions were followed like nil by mouth. Okay, so this is the task and we can construct the sentence like this. So in this task, we have to collect the information from the bystander, that is mother. So we can use signposting sign here. Okay, so like this. Prior to moving forward, I am going to ask you some questions. Okay, so in OET role play, we can ask the question one by one. Okay, never ask all the question in a single sentence, that will confuse the bystander. Okay, so like this, I will tell you first question we can ask. Did he experience any difficulties, particularly like sore throat, fever, and difficulty in swallowing? So this is the first question we can ask. And as soon as the relatives or the bystander tell us the symptoms of the child, we can, as a nurse, we can said, "Thank you for your information," or "Thank you for letting me know the symptom of your child." So next we can also ask next question. I hope pre-operative instructions were followed correctly. Am I right? So the relative or the bystander mother said that, "Yes, sister, but I have concern regarding surgery." So now the mother have concern regarding surgery, and in the task number 3, it's given like this. Explain the tonsillectomy procedure and what to expect during surgery. Like common quick surgery, removal of tonsils through the mouth, general anesthesia, will not feel pain during surgery. So it is explain. So here as a nurse we have to explain about the procedure. So we can start like this. I really understand you have concern about procedure, but set your mind at ease. So this sentence will help the mother to feel some relief and set her mind at ease. So, before explanation, we can use one empathetic phrase so that our patient or bystander feel comfortable. So we can say like this, I really understand you have concern about procedure, but set your mind at ease. It is very common procedure and it is going to be quick procedure in which tonsils will be removed through the mouth. Don't worry, general anesthesia will be given there. Therefore, John will not feel any pain during surgery. Is that clear to you? Now see, here is explained. So once the nurse explain all the procedure, then last we can also check the understanding of the mother that she has understand what as a nurse we have explained to her. Okay, so we can use this phrase like this. Is that clear to you? So please use in your speaking too. Okay. So next another is fourth task. Here again describe. So describe means again we have to give information to the bystander. Okay. So describe the immediate aftercare and what the child may experience post surgery, like mild sore throat and ear pain are common for a few days, will be monitored in recovery, given fluid once a week, soft diet recommended, avoid hard spicy food, and find out any concern or question. Okay, so fourth task we will construct like this. As a mother, she has concern about the aftercare of his child. So we as a nurse we can tell the mother that I can understand being a mother it is very difficult, so don't worry, I will explain to you about after the surgery. John may experience mild sore throat and ear pain. These are very common for the few days, and he will also monitor in recovery, and also we will provide some fluid once he awake. And I highly recommend to give soft diet and avoid spicy and hard food. Okay, so this we can explain like this. And at last, find out any concern or question we can ask. Do you have any other concern to ask? Okay, so as a mother, she say that I don't have any concern. So being a nurse, we can say, well, at last, I would like to have a consent for for preparation of your child John for the procedure. So when the mother is willing to give you consent, we can say thank you for your cooperation and I will do the needful. Thank you. And at last we can say to the mother that you have cooperated with us and also give us consent. So at last you have to give some thanks to the mother. Okay, so well friends, I hope this role play will help you as a bystander. It is very important because one from two of the role play, one will be on the bystander part. So thank you for watching my video. Thanks once again.